we decided to do our project on alcohol use and trauma. Trauma means experiencing, witnessing, or being threatened with an event or events that involve actual serious injury, a threat to the physical integrity of oneself or others, or possible death. An emotional response to a terrible event like an accident, rape, or natural disaster.
The American Psychological Association says that PTSD, or post traumatic stress disorder, is an anxiety problem that develops in some people after extremely traumatic events, such as combat, crime, an accident, or a natural disaster. Some of the symptoms include flashbacks, nightmares, avoiding anything that reminds them of their trauma, and having anxious feelings that they didn't have before that are so intense that their lives become disrupted.
We're also going to talk a bit about stigma, meaning attitudes and beliefs that lead people to reject, avoid, or fear certain groups, a group that is perceived as different. Self stigma happens when someone internalizes negative beliefs. For example, individuals themselves struggling with addiction or dependence take on attitudes of others about personal issues that ultimately lead to shame, fear, anger, and hopelessness, stigma from within.
Addiction, mental health, and co occurring disorders equal a person who is diagnosed with a substance use disorder and a mental health condition, such as depression. Some common types in people with addiction are depressive disorders, bipolar, schizophrenia, obsessive compulsive disorder, anxiety disorders, and what we will be talking about, PTSD. Although other things can be present, these are the types that are most commonly diagnosed and discussed.
Basically, it causes the fight, flight, or freeze reactions to be overstimulated, making homeostasis hard to maintain. The sympathetic and parasympathetic systems are out of sync with each other.
Some key areas of the brain are impacted by addiction, specifically the central nervous system, consisting of the brain and the spinal cord, which are responsible for a range of activities, including cognition, memory, mood, and coordination.
The cerebral cortex is responsible for maintaining cognitive functioning and is divided into four main lobes.
The parietal lobe's main functions are sensory input for things like taste, temperature, navigating environment, touch, and visual spatial processing. And when compromised by psychoactive substances, they have effects such as slow reaction time and may cause inability to avoid bumping into things.
The frontal lobe is responsible for impulse control, planning, and decision making, and while under the influence, interferes with decision making, not taking into account consequences, lack of inhibitions, and low self restraint.
The temporal lobe is responsible for auditory perceptions and language, and not surprisingly, when it's affected by substances, it can cause slurred speech.
The occipital lobe is the visual processing center, accounting for blurred vision while intoxicated.
Alcohol is also a depressant. Its general effects include impairment of motor coordination, decision making, speech, vision, dizziness, and drowsiness, confusion, and it also impacts balance, cognitive processing, and memory.
At low blood levels, causes slurred speech, staggering, increased impairment, lowered alertness, and euphoria. And at higher blood levels includes all those things that I just mentioned, and most importantly, a lack of critical mental functioning. PTSD and alcohol or psychoactive substances affect homeostasis, which is basically the body's desire to maintain balance at all times and maintain a status of equilibrium.
The general population estimates that between 13 and 45% of women will experience some form of sexual trauma in their life.
Still a reality for men, but less of them report or realize it. Studies have shown that males have higher cases of risky drinking behaviors than females, and females are more likely to develop PTSD.
Unfortunately, sexual abuse starting in childhood can put women at higher risk for repeated assault during adulthood.
This theory was proved by both of our experiences later in life.
One study reported a link between a history of sexual trauma and increased internalized stigma.
Childhood trauma is particularly prevalent in people with alcohol dependence, and trauma increases vulnerability for all mental disorders and can have multiple consequences for affected people.
Such as poor physical and emotional health, lower quality of life, loss of self confidence, and negative beliefs.
Also, shame for having these issues and internalizing negative stereotypes and applying them themselves.
Personally, dealing with these issues on a daily basis led me to find means of escape in drugs and alcohol.
We both started drinking to cope without realizing that's what we were doing. We didn't know each other before this class, and we had extremely similar experiences starting alcohol use at ages 10 and 11 as a way to deal with early childhood trauma starting at ages 5 and 6.
Which unfortunately makes a lot of sense because women tend to start drinking more heavily after a traumatic event to manage symptoms like intrusive thoughts or memories, sadness, and anxiety driven feelings.
With our progressive, moving from self doubt to losing self confidence, essentially losing one's voice and ability to set boundaries and try to find other means of control.
I began to withdraw, shut down. I became really hostile, and we both started experiencing depression or symptoms of depression and anxiety in the form of cutting, burning things, and panic attacks, and difficulty doing everyday tasks. I was angry and I took it out on everyone else around me who was trying to just be there for me and figure out what was going on.
It's a statistical fact that chronic exposure or repeated traumatic events may be associated with complex PTSD. Symptoms, which include emotional regulation difficulties and dissociative symptoms persisting longer than 1 month after the activating event. Everyone dissociates to some degree. Like with pain, we can't recall pain. It's our natural defense to distance ourselves from unbearable pain. But with trauma, it essentially blocked my memories or ability to recall the trauma until I was in my 20s.
Women report greater frequency, trauma related avoidance, and greater social impairments like adverse anxiety, meaning feeling nervous, tense, inability to remember important aspects of traumatic events or a specific event, and they may use substances to reduce symptoms of trauma, well, unintentionally putting themselves at higher risk for repeated traumatic experiences.
Alcohol consumption increases impulsivity, sensation seeking, and lack of premeditation, or drinking to cope with some event not assessed. Or in this case, drinking was both a protective and risk factor based on context and symptomology.
Those who use substances are more likely to be in high risk situations linked to re victimization, which is something we're both all too familiar with. And when you're impaired, you may not realize that you're putting yourself in a dangerous situation, such as driving while intoxicated, going to a party alone, inviting strangers into your home, ignoring consequences, risky sexual behaviors, promiscuity, not using protection.
75% of Americans have experienced a traumatic event. Trauma exposure is virtually identical for both men and women. 75% of those who develop PTSD following trauma are women. The number of Americans who develop PTSD in their lifetime is 6.7%. And of those, 32.7% report substance abuse or dependence. Some forms of treatment for PTSD include
CBT
CBT and
and
EMDR.
EMDR. CBT is cognitive behavioral therapy. Treatments usually involve efforts to change thinking patterns, such as learning to recognize one's distortions and thinking that are creating problems, and then reevaluate them in light of reality. Using problem-solving skills to cope with difficult or stressful situations. Example, using role play to prepare for potentially problematic interactions with others, especially while in treatment. Throughout my experience with CBT, it helped me restructure my thoughts about the world as it truly was versus my altered perceptions that I had when I was using and even when I was newly sober. I can honestly say that I'm glad that I'm sober and I'm happy that I'm alive today.
And EMDR, or eye movement desensitization and reprocessing, is where the person being treated is asked to recall distressing images. The therapist then directs the patient in one type of bilateral stimulation, such as side to side eye movements or hand tapping. This therapy is based on the idea that negative thoughts, feelings, and behaviors are the result of unprocessed memories, which is true for me. I was skeptical at first, but I was surprised to find that as I started to recall memories, I was able to process them as an adult rather than my limited understanding as a child. I can't say that the process was painless, as it was re traumatizing at times and very difficult. In hindsight, I'm glad I did it though, because today I have very limited trauma responses, such as flashbacks, nightmares, intrusive thoughts, feelings of discomfort in crowds, and I don't watch disturbing shows and movies anymore. I used to be oddly drawn to watching those things, such as like Law and Order, SVU, before I knew I had PTSD. And it's just interesting that it would, draw me to those things. And
Mhm.
now today, like I don't do anything to trigger that stuff anymore.
And that is our project on alcohol
And PTSD.